The HealthView Center for Preventive Medicine in Newport Beach, California, began seeing patients in 1997.
My name's Kathleen. I'm 49. Hi, Bill. So I want to get this done before I'm 50. Looking at the family history, yeah, there could be all kinds of things. Different cancers, osteoporosis, osteoarthritis. Those are the bigger concerns. So, yeah, I'm a little nervous. I think that's one of the reasons I decided I better come here and get clear on where I am health-wise.
You're going to feel like it's a sensation like you want to burp.
Oh, great.
HealthView is a three-dimensional computerized journey through your body, from your neck to your pelvis.
Are you ready?
Yeah, my lifestyle's been up and down. I'm hoping that coming here is going to help motivate me to stay on track better. It's time for me to get a little more serious about taking care of myself better.
Dr. Harvey Eisenberg invented and launched the HealthView program in an effort to shift the emphasis in medicine from reactive to preventive care.
The end goal of our product really is a process that is intended to extend the length and the quality of life of each individual. This is really a very similar concept to what an annual physical examination was intended to be. We're basically finding the problems, motivating the patient, educating the patient, and then beginning the process of telling them what needs to come next in their treatment program, and their doctor's going to receive back a patient who's been very motivated.
The HealthView scanning session lasts about 20 minutes. It's painless, non-intrusive, and allows patients to remain fully clothed. HealthView's scanner quickly acquires images of the patient's torso from the neck to the pelvis.
What if I sit down in that consultation room and the doctor says, well, we found something, and you have 3 weeks, 3 months, 3 years. There are going to be people that come through this door and they're going to get news that they had no idea that they had a problem that's as bad as it could possibly be. I have my sister here with me today. She wants to sit in on my consultation. I want to sit on hers. I think anybody who comes in for a test like this, if they could bring a loved one with them, I think it would help support them going through this process.
HealthView features on-site analysis of your results within just a half hour of completing the scan. During the consultation, the patient meets with a physician who leads you through a computer-generated tour of the inside of your body. Your comprehensive review includes the heart and arteries, lungs, breasts, the spine, and internal organs.
How much smoking do you do?
Well, not much on and off through the years, though. I started smoking when I was 17 and then on and off.
Okay.
And stress things come up, I smoke some and then I don't.
We are seeing an area here that is what we call a bullae or a bleb on the lung, and that we're going to relate back to your smoking.
Most importantly, HealthView is completely confidential and will not release your results or information to anyone unless you ask them to.
So you in fact were developing the early stages of emphysema in your lungs.
I hardly even smoked compared to some people.
Well, a lot of people vary very much in their sensitivity.
Okay.
The impact of witnessing disease in your organs usually motivates patients to make changes in their lifestyle patterns.
Number one thing is never smoke a cigarette again.
Right. Okay. So this is very clear.
Wow, very clear.
When disease is detected, HealthView educates you about your options, in addition to making specialist and testing referrals.
The place we'd like you to look first is food. We've evolved into a culture of fast foods and packaged foods, and we really want you to get away from that. We really think you should eat fresh, organically grown fruits, vegetables, fishes. Okay. The next thing that wrecks the human immune system is stress.
Yeah.
Okay. The issue isn't the stress, it's how you manage stress, how you deal with it. And this is your window to know that you're controlling it, so that you can reinforce that throughout really the rest of your life. What we find is almost always curable, stoppable. So it really is a matter of educating them, giving them a roadmap as to what's actually going on, and educating them as to why it's there, how it got there, and what you do to stop it or reverse it. What we have called current medicine is crisis management, and crisis management doesn't work. You need to be proactive in dealing with your health, just as you're dealing with your family, your business, and every other aspect.
First thing that comes to my mind is relief that it's over with, because I was, I think, a little more stressed than I thought I was. I think for me the bottom line was I have the total responsibility for my own health. And I have that responsibility even more now, because now I've seen the actual pictures of inside of me. This is what's going on inside of me. I think that it would benefit everybody to come in to do this. It's a little scary I think we all need a jolt of reality sometimes, and this is what this was for me. But I feel so relieved to know it wasn't anything big and terrible.